Hi, good morning. I'm Dr. Stephanie Gardner. I'm an emergency medicine physician at St.Vincent Hospital and at Hancock Regional Hospital. I also do all of our EMS medical direction for those hospitals, so I teach and train our paramedics, firefighters, and EMTs. And this morning I'm going to talk to you about an app called PulsePoint. I have no financial disclosures. I'm not paid by the company or speaking on behalf of the company, although if they want to pay me, I would certainly allow them to. So, if you have any contacts. All right, so PulsePoint in a nutshell is a mobile app that alerts CPR-trained bystanders to someone nearby having a sudden out-of-hospital cardiac arrest. And sudden cardiac arrest kills more patients in the U.S. than all of these combined, so a huge issue, as you heard this morning already. We have more than 350,000 people in the U.S. that experience a sudden out-of-hospital cardiac arrest every year, so more than one event every 2 minutes. And only about 8%, less than 10%, as we've heard, of cardiac arrest victims survive their event. So 92% of patients do not survive their out-of-hospital cardiac arrest, which is huge, right? So how do we improve? How do we make that better? What makes the difference between someone who survives their cardiac arrest and someone who doesn't? So going to the literature, Predictors of Survival from Out-of-Hospital Cardiac Arrest, this was published in Circulation in 2009. They found you were more likely to survive your event if your event was witnessed by a bystander or EMS, if you got bystander CPR, if you were in a shockable rhythm, so VFib or VTAC, and if they got pulses back. Okay, so witnessed event, bystander CPR, shockable rhythm, and pulses back. Of these, if we're looking to improve these outcomes, the modifiable factor here is bystander CPR. Okay, so does this actually make a difference, bystander CPR? Turns out it does. So this was published in the New England Journal of Medicine 2015. 30-day survival rate more than twice as high if you got CPR in the few minutes before the EMS got to you. Okay, so why does that matter? Because the brain begins to sustain damage after cessation of blood flow for only 4 minutes, and irreversible damage begins at 7. Our best EMS system out there get to your side in 5, maybe 10 minutes, rural systems even longer than that, and we're seeing irreversible damage at 7. Okay, so bystander CPR allows enough oxygen to reach the brain to delay that brain stem death and allow you to get to care. Okay, so how do we increase bystander CPR? CPR came out in the early 1960s. American Heart was endorsing CPR by the early 60s. We were teaching public CPR classes. We are having our medical dispatchers, as of 1981, are telling callers who report a cardiac arrest to begin CPR and exactly how to do it. We're putting fun little devices in public places. This one's in our airport. If you haven't seen it yet, next time you're waiting for a flight, go over and remember how to do CPR. And despite all these efforts, we have a national bystander CPR rate of only 33%. 1 in every 3 victims gets bystander CPR. Okay? Locally, I told you I work out at Hancock Regional Hospital that's in Greenfield, Indiana. I looked at our rates there. January to September of 2016, we had 67 out-of-hospital cardiac arrests. How many of those do you think got bystander CPR? If we're on par with the national rate, that would be, 22 1/3 of them? 9. 9 of those patients got bystander CPR, less than 15%. Okay? So I figured we got to do something. We got to do something different here, and that's where PulsePoint comes in. It's an app that gets people who know CPR, who are willing to do CPR, to the side of someone who's having an out-of-hospital cardiac arrest. So this is out there. It was launched as a pilot program in February of 2015. Currently, there's more than 1,300 separate fire and EMS agencies in the U.S. that are already using and have implemented PulsePoint. I pulled the stats just from October 7th, a couple days ago. They had 72 activations that day and activated 237 responders, and are currently at over 27,000 activations of about almost 80,000 responders. So this is the map from Cleveland, Ohio, from October 9th. I just took a quick snapshot of this. This is over 12,000 people CPR trained who have downloaded the app, who are willing and ready to respond at any moment. So it's out there, it's being used, it's saving lives. I took this program to our hospital board at Hancock Regional Hospital in January of this year and presented this to them and asked them to invest in this app, and they were all on board. So we have currently invested in the app. We're in our implementation phase out in Hancock County, and we are going live in 2017, in next month. So there you go. Thank you.